Sometimes in the past, nursing has really focused more on just symptoms in a vacuum or just diseases in a vacuum, but nothing's in a vacuum. And really, nursing is about context.
Working as a trauma nurse, I was embedded into an emergent situation, hospital beds, acute stay. And what I kept seeing was persons coming in with a physical injury, but really by the time they're leaving, the focus was no longer on whether a wound was healed, but the emotional effects of that afterwards. We were merely focusing on the injury. And that drove me into my research now, which looks at the mental health outcomes afterwards.
So social determinants are things like having enough food or not, access to good food, ability to walk places. People's self-efficacy and their ability to take care of themselves are impacted by the structural factors, and we can work on the individual aspects as well. But if someone doesn't have enough food or has to choose between food and medicine, that's a difficult choice.
I can actually not just prescribe a medication for them, but I can connect them to services like, let's sign you up for government services for your child. Let's get you transportation needs help.
As nursing schools, we need to educate students so that when they are out in the field, in schools, in hospitals, in community clinics, that they're approaching each person who's a patient with their context in mind. The most impactful thing to do is to see patients as people and to call them people or persons instead of patients, and to address them the way we would want to be addressed, and that includes in terms of their communities. And simple belief that we're all equal with the same amount of dignity goes a long way.